first you need to pick between the smart tubing or the normal tubing. So making sure you have the smart tubing with the blue plastic part covering this that'll run through the pump. And then finding our brain here. You can attach it to the pole. There's also sometimes poles at bedside that you'll be attaching it to. So just screwing this on the back here. And then making sure to take this white paper part off is going to show you that they have recharged it. Then taking what's called a channel here. Taking the white paper off. And then this just kind of clips in the side. And then push it in on the bottom. There we go. Then you can press system on. Takes a second. Opening the smart pump tubing and taking it out, making sure to remove these white paper pieces and then also this blue plastic piece. If it starts beeping at you, you can just hit silence. Taking your medication bag. So this part is going to go into the blue covered piece of the medication bag. So you can just pop this off. And then take off this clear plastic part here. And this goes right in here. And just pushing it up as far as it can go. And so the medication's going to start dripping in through here. And then this is a vent here, so if you open that, and then usually I do this going over a garbage can because you want to prime it down. So it's going to run through, and this is the clamp here. So you want it to run through so that there's preferably as few air bubbles as possible in the line. So here you can see that there's a couple smaller ones. Those shouldn't be as big of a problem. And then just clamping down here. And then you're ready to attach it. So you can place the bag up on the hook. And then, so this is where that blue plastic part was. And this clip is just going to clip into here. And then you're going to want this to attach right up here. And then you can close the door, pushing this down. Alright, so then we need to program the pump. So it's going to ask you for a new patient. You're going to hit yes. Adult, also yes. So then it's going to ask you to put in a patient ID entry. Usually if we're in the trauma bay, we do it by A, B, C, or D. So we're in that D right now. So we're going to press D. It'll type it down here and then press confirm. So then it's going to say what channel you want. So it'll recognize if there's channel A here and there's nothing else hooked up. So there's just the option A. So we're going to hit channel select on the channel. And then this will lead us to picking what type of medication we're running through. So this is going to be a guardrail drug, which is most medications that we'll use. We'll hit this, and then it brings it up alphabetically. So if we're going to look for propofol, we'll pick P through T. And then you can scroll down here until we find the propofol. So picking propofol, it's then going to ask you for the concentration. And so usually we're going to have the 1,000 milligrams per 100 milliliter bottle. So we'll pick that. It'll ask you to confirm that. We'll say yes. It's going to ask for the patient weight. We're going to put in an 80 kilogram patient. And you'll hit next. And then it'll ask you for rate, volume to be infused, and dose. So we're going to pick volume to be infused. Usually I do about 10% over what the bottle or bag is, just to make sure that it gets all the medication through the line as well. So if it's 100 milliliters, I'm going to put 110 milliliters in. And then you'll pick the dose. So for dose, we're going to start it at 20 mics per kilo per minute. So then after you have all of that in, you just press start. And then it'll put over here what your rate is and checking the line, and you're just going to want to pause it right away. So it'll have 20 mics per kilo per minute of propofol. And then it says that it's paused. So at this point, you can just kind of hang the line up here, and then it'll be passed off to the nurse to be put into the patient.